Welcome to part 2 of Dr. Loria's Girth consultation video. In this second part of the series, Dr. Loria will discuss satisfaction rates and patient compliance, pain and discomfort, and the available girth treatments for the penile shaft, penile glands, and scrotum.
We discussed how many treatments are needed. It could be 2 or 3. It all depends on the size you're starting with, right? Now let's talk about satisfaction rates, okay? Satisfaction rates. The satisfaction rates are high for those who follow protocol. Satisfaction rates are not as high if you do not follow protocol. And why is that? Here's an example. When you have a procedure done, you basically walk out with a bandage looking like this, okay? There's a rubber band down here, there's some blue gauze here, there's some brown gauze here, etc. Okay? This here has to be maintained. Okay, you can change this every day or every other day, but the important thing is this barrier. You see this rubber band down here? Okay, this is a barrier preventing the filler material from exiting. Now, if you choose to, after a day or two, just take this off and not wear it, you risk losing filler coming out into the scrotal area or pubic area. Okay, it's not dangerous, but we don't want the filler here, and we don't want collagen production here. We want it here. Okay, so patients who follow instructions carefully and communicate with me on a daily basis, which is very important, will do well. Okay, so the bottom line is, if you're going to do this, commit 100%. Okay, you're either in 100% or not. So I'd rather you, when you decide to do this and have the filler treatment done, commit yourself. Okay, we need to follow you for a 21-day period. You probably need an hour a day to take care of this, because you're going to change your wrap. Every other day you're going to take an Epsom salt bath, because it's very good for skin healing and so forth. We'll go into the details in another video. This is just an introduction to this process, to this minimally invasive procedure. Okay, so if you're going to do it, you commit yourself. Okay, 100%. Now, let's talk about pain and discomfort. Okay, the procedure is very simple. We numb the area where you basically feel nothing. Okay, the discomfort comes later. Okay, because this here rubber band starts to irritate you. Okay, usually by day 3 or 4, this will start irritating you. It might throb, might get some sort of pain, discomfort. Okay, but there are ways to take care of this. You can use lidocaine cream that we provide by prescription, where you could Q-tip it under there for comfort, and also some other creams that help. Also, you take a rubber band break periodically. So there are ways to handle discomfort. Okay, so the procedure itself is very simple and straightforward. The aftercare, maybe by day 3 or 4, you start getting discomfort down here, and we deal with that, okay, by using pain medications and creams. Okay, so don't worry so much about pain and discomfort. We can keep it under control. Okay, now let me tell you what we do exactly, what we treat. When it comes to male enhancement, we have several components here that we can enlarge. Okay, we have the shaft, which is the long part of the penile area. We have the glands, which is the head of the penis. And then we have the scrotal area. We can actually enlarge all 3 areas if you wish. Okay, and most men choose to do the shaft, but I recommend adding the glands as well, because as the shaft gets larger, you want there to be some proportion with the glands. Okay, now the glands does not increase at the same rate as the shaft. Now, years ago I used to just recommend doing the shaft, and if you needed to do the glands, you do it later. But that was a mistake, because we realized that the shafts were getting so big so quickly that now we're playing catch up on getting the glands larger. Okay, so if you're doing a shaft, try to do the glands as well, so at least we could keep it at proportionate range, which is very important. All right, now if you're married, you don't care if there's a little imbalance, not an issue. Okay, but if you want to keep some cosmetic balance, that's what you'll do. Something to consider. Also, besides offering enlargement of the shaft, the glands, and the scrotum, we also provide services, circumcision services. Also, we're going to provide flaccid lengthening. Let me explain what that is. Typically, when you're relaxed, the penis is a lot shorter, right? Maybe 2 inches or 3. Now, when you're erect, obviously, it gets longer. Now, when you're flaccid, some men shrink down a lot, 1 to 2 inches. And no one likes that, right? They call it the shrinkage, right? So what we're going to do is we're going to put a pen-like structure. It's really silicone, medical grade silicone, a thin sheet, looks like a pen, but flat, okay? And we would insert something like this under the skin and keep it here, okay? Now the penis cannot retract because you have this insert in, okay? So that's an excellent way to prevent that shrinkage from occurring. So you'll be hanging long all the time. And of course, when you do your girth treatment, you'll not only be hanging longer, but much thicker, okay? Now, let me just go over something with the scrotal enhancement. You might say, why would someone want a scrotal enhancement? Some men have small testicles, okay, and this area is very small, so they want to enlarge that size, which can be done. Also, some men have very strong muscle cells in this scrotal skin that causes contraction. It causes discomfort. It can cause the testicles to come up into the body a little bit, very uncomfortable. So we can fill this area, not only make it fuller, but help prevent that contractile force from doing that. Okay, those are two main reasons why we do the scrotum. Okay? Now, I mentioned about circumcision, that we do provide that service. Now, if you're not circumcised, I highly recommend getting circumcised, because that foreskin, this is someone who is circumcised. This would be a model of someone who would be circumcised. But the foreskin would actually cover this glans area, okay? So let me show you what would happen if you remained and kept the foreskin. In a procedure, we insert the filler underneath the skin here. Then there's going to be some inflammation. Sometimes the inflammation will work into the foreskin and cause that to swell. And then it gets irritated, it can cut, you can get skin sores. It's a miserable experience for a lot of guys, okay? My recommendation is get the circumcision first, okay? Anytime you do the circumcision, make sure very little amount, tiny amounts of the foreskin remain. So whoever's doing that circumcision, like a urologist in your local city, make sure there's only a 1/4 inch left of the foreskin underneath the glands. 1/4 inch, and that's it, okay? Because you get better results with less foreskin everywhere. So when you have your circumcision done, just a 1/4 inch left, okay? So let me give you some real numbers. 3 out of 10 patients who are not circumcised do well. The other 7 have to have circumcisions later, okay? Those are real numbers. Now,